Hello everybody. My name is Dr. Lindsay Ogle, and right today I'm here with Emily, and she is a registered dietitian going to be talking about binge eating disorder. So, before we get started, I'm going to have her introduce herself.
Hi guys, my name is Emily Wendt. I am a registered dietitian. I have been a dietitian for about 10-ish years. I have a private practice based in St. Louis, Missouri, called Restored Nutrition. I specialize in helping clients who struggle with eating disorders, disordered eating, performance and sports nutrition. And then also, I work with a lot of people who have maybe never been diagnosed with an eating disorder, but have always struggled in their relationship with food and how to balance wanting to maximize nutrition without feeling obsessed. So that is kind of, I'm based in St. Louis, but I am licensed in Missouri and Illinois. So I see a lot of clients virtually nowadays too. So gives us a little bit more flexibility of who we can work with.
Absolutely. Well, I'm so excited to talk to you about this important topic, binge eating disorder. And we'll just start off by kind of a general question. What is binge eating disorder?
Yeah, so binge eating disorder is one of kind of the big three when it comes to eating disorders. I think when we think of eating disorders, most people, not everybody, but most people kind of think of anorexia, bulimia, and then binge eating is the third kind of big one, and then there's another category of other ones that fall into there. But actually, binge eating disorder is the most common, which we'll get to that. But a binge is, to define a binge eating disorder, we have to ask what a binge is. So it kind of has a vague definition in the DSM. So the DSM tells us it's eating more in a 2 hour time period than most would, which vague. But I think about the most helpful thing to characterize it is a feeling of loss of control. So feeling like you are eating past fullness, past when you want to. There's physical fullness. You're not like hungry anymore. Sometimes you might really try to eat not in front of others because you're self-conscious about how much you're eating or how quickly you're eating. It also big hallmark is feeling of shame, shame, guilt. I always tell clients like if you shouldn't feel guilty after eating unless you stole the food. So if we're regularly feeling really guilty after we eat, that's always something that I'm a little bit curious about. In other words, are we eating to a point where we're feeling physical and emotional distress? And the severity kind of happens on a spectrum, but some people who with binge eating disorder binge multiple times a day, that would be really severe. But even if it's happening as regularly on a regular basis, as much as once a week, then it's something that kind of merits looking at and asking some questions about what might be going on.
Yeah, excellent. And kind of a follow-up question on that, and you
Sure.
touched a little bit on this, but I think I have a lot of patients that come to me and maybe are concerned they may have binge eating disorder, but when we tease it out, it doesn't quite meet the criteria. And
Yeah.
I kind of call that emotional eating or stress eating. Can you touch on like the difference between those?
Sure. Yeah, so I think eating disorders exist and disordered eating exists on a spectrum, right? So something is clinical, which basically that just means it fits that DSM criteria. We can diagnose it. I always tell people, even if it's not diagnosable, that doesn't mean it's not a problem for you. So I treat a lot of subclinical eating disorders. So maybe they don't fit that criteria, but it's something that I think the hallmark is if it's a problem is we're all emotional people. Sometimes I've had a day and I'm craving something comforting. But if the only way I know how to cope with my emotions is through food, and if I'm regularly feeling distress, I think that distress and the loss of control are the two hallmarks for me. I think when we think about a disordered relationship with food in terms of binging, it's not really like, oh, I 3 cookies is okay, but 5 cookies is a binge. It's more so like, why are we doing it? What's going on? How are we feeling physically and emotionally afterwards? And do I feel in control of myself around food, physically and in my thoughts? Most people who have a disordered relationship with food, even if we couldn't put them in that category of clinically having binge eating disorder, they regularly feel out of control.
Mhm. Great. Yeah. Thank you so much. I think that's really
Sure.
helpful to kind of make that distinction
Yeah.
and acknowledge that there is kind of a spectrum of the condition.
Yeah.
How common is binge eating disorder?
I think it surprises some people to know that binge eating disorder between those big three is actually the most common. So it affects 3.5% of women and 2% of men, and a three times more people than anorexia and bulimia combined. And that's with the fact that that's probably a huge underestimation. Binge eating disorder is the least understood and the most stigmatized. The most common eating disorder with men too, and we know men are vastly underdiagnosed and undertreated for eating disorders. And so it is a huge problem. And I think there's stigma with all eating disorders, but there's such a stigma and shame around binge eating disorder that really unfortunately prevents people from getting help. Because I think a unique and difficult thing with it is it sometimes sent the message, or people would perceive that it's just from a lack of willpower. If they could just have willpower, it's their problem. It's weakness that they have this struggle, and they just need to like figure out how to be strong enough, and then they won't struggle with it anymore. And so that holds people back from recognizing like, no, this is an actual problem that has to do with my mental health. There's emotional triggers and physical health, and I often need outside help. It's not necessarily something that I can just white knuckle my way through. And it's not a personal failing.
Yeah, absolutely. I strongly agree with that.
Yeah.
Thank you for bringing that up. Um, if what may be some signs or symptoms or like a warning sign that someone can recognize either in their day-to-day life or kind of looking back and reflecting that may indicate binge eating disorder?
Yeah. I ask this question to pretty much every client that when I first meet with them, regardless of why, but definitely with any eating disorder, disordered eating clients. And so binge eating would fit into this, is I have them, people think about their brain as like a pie chart. Like, okay, all my brain space. So all the stuff that I'm thinking about throughout the day, what chunk of that is taken up by food?
Mm-hmm.
Obviously, food is a little unique in that we have to think about food. Like human beings have to feed themselves. I have to go to the grocery store. I have to cook breakfast. But people who have a disordered relationship with food and eating disorders, their brain thinks about food. I will hear people say 90%, 80%, 70%. So if it is more than, this is something that I just use in my practice. So it's not that 20% is magical, but I think about, and it's give or take. Some people think a little bit more. Maybe they have allergies, or they're cooking for a large family, or they love cooking, or their job involves food. Sure. But if it's significantly more than 20%, then that's always kind of, for me as a clinician, a red flag of, okay, what's going on here? Food is taking up a lot of this person's brain space, day, thinking, and that could be an indication that something else might be going on. And then I also think asking yourself, how often am I experiencing feelings of shame, guilt, distress after eating or around food? Because I would say those feelings are very, very common, but I don't think that they're normal or appropriate in a healthy relationship with food. So it's tricky because common sometimes equals normal, but when I'm looking at like a healthy relationship with food, it might be normal to eat too much sometime and be like, oh, my stomach hurts. I wish I wouldn't have done that. Right. And we want to then pay a little bit of better attention to our body. But if I'm regularly feeling guilt, ashamed of myself, I hear the word disgust a lot. Like, I feel like I'm disgusting, then that is an indicator that, hey, something's going on in my relationship with food that it needs to be looked at. That's not normal, and that doesn't have to be, and that shouldn't be there anymore. And if you're eating past that point of physical discomfort more than once a week, and it's a regular part of your life that causes you distress, then I think that should also be a red flag for us of looking at what else could be going on.
Yeah, yeah. Thank you so much. That's very helpful. And I like that pie chart idea because that's very visual and easy
Yeah.
to conceptualize. So thank you for
And I
that.
often find people are surprised that when they realize how much of their brain space is taken up by food, and then maybe how much maybe should be.
Yeah, yeah,
Yeah.
yeah. Because we spend all of our time in our own brain. We may not
Yes.
know, what is quote unquote normal or average or common for other
Yes.
people. Yeah, so I'm curious in your clinical experience, what do you find can be common triggers for a binge episode?
Yeah. I think about them in two categories, like physical and then psychological. And so as a dietitian, I'm often like that first line of defense at looking at the physical component. So when we think about a physical trigger to a binge, the simplest answer that often surprises people, but really is the most common trigger is restriction. So, um, interesting statistic is that 30 to 40% of people who are seeking weight loss, pursue weight loss, have a history of a lot of dieting, are affected by binge eating disorder in some way, because restriction is one of those biggest triggers for binge eating. A lot of people will, who come to struggle with binge eating, I talk about it like a rubber band that's we're stretching it really thin. So whether they're pursuing weight loss or it's with intentional restriction, or maybe they started maybe with some restrictive eating disorder habits or disordered eating habits, or sometimes it's accidental where they just skip breakfast, they're not thinking about it, they go long periods of time without eating. Even if they're not physically stomach rumbling, it's like your body wants food. It functions best on food regularly. So if we start to restrict, it's like that rubber band of stretching and stretching and stretching. And for most people, it's not because they're a failure of willpower or they're just not trying hard enough. The rubber band will snap back. And it will trigger this binge where our blood sugar gets low and your body is really and your brain is driven for survival, right? So you think about it when you get really, we all think about this when we get really, really hungry. I'm just like, okay, what can I eat? I'm so hungry. I can't wait to get home and just eat. Just your brain will think about food. It will turn on your food thoughts. Food will sound and taste so delicious.
Mhm.
And so if that's happening regularly where I'm restricting myself to really low calories, way too low calories, someone told me to go lose a bunch of weight really quickly and I don't know how to do that, then I might not eat nearly enough, get to a point where I'm around all these foods that are really highly palatable and oh, here comes the rubber band, it snaps, I start eating a lot, which is a normal physiological response. And then I feel really guilty about that. I'm like, well, wait, I was supposed to only eat this many calories, or I was supposed to lose weight. So I feel terrible about myself. I feel guilty. And then I feel like, you know what, I need to go do restrict again. And so it's this yo-yo pattern of like we're swinging back and forth between these extremes. And then when someone has that diagnosed binge eating disorder or that clinical binge eating disorder, there's always the psychological component as well. This eating disorders are mental illnesses, right? So there's this piece of in that instance, it could be a similar trigger to someone struggling with anorexia or bulimia, but it's manifesting differently where they are eating for comfort or to manage stress or to manage anxiety or to manage trauma. And when those two things come together, it's like that perfect storm where I'm not eating in a way to take good care of myself, I'm restricting, and then something stressful happens in my day. I'm reminded of something that triggers me. I'm really anxious. I'm trying to numb out.
Mhm.
And here comes a binge. And then typically that leads to both a physical and that psychological spiral too. We feel bad physically, we feel bad mentally, and then we kind of just do it all again.
Yeah, yeah, absolutely. Well, thank you for kind of painting that picture of what that might look like. I'm curious. So, if somebody is listening to this conversation and they think, I have had some of those experiences, or I recognize some of those patterns in my own day-to-day life, what might you recommend that they do as next steps to either help get that diagnosis or move forward with treatment?
Yeah. So I think reminding yourself that it's always good to reach out for support and that oftentimes when we struggle with these things in our head, food is just really intimate and vulnerable. Um, and so when we're reaching out for help, most important thing to say first is the people that are trying to help you are not thinking the same thing in your head that you are, right? This is something that I do day in and day out, and people are often so nervous and ashamed to talk about these things. And I think that reminding yourself that like actually talking about them is the first step to one, reducing the shame. We can't get better if we don't reduce the shame. And then that allows us to be curious and learn what might be going on and what can I shift and what contributed to me getting here. Um, but when specifically with binge eating disorder, I think it's really important that we're addressing both that physical and the psychological component. So in an ideal world, we'd have the medical piece. So like our doctor is looped in, looking at what's going on. We have a therapist. So we're talking about what might be my triggers. How can I cope if I'm binging because I'm really stressed or anxious or dealing with some trauma? Like, what can I do instead? What are the things that I need to do to work through those things? And then also working with a dietitian who could help us understand what are my body's physical needs, what meal plan might help me regulate my body so that I can be set up. We can neutralize that physical component and set up to not be so primed to binge. And the dietitian can also help us work through, if we have that history of extensive dieting or yo-yo dieting, hey, what's actually true about nutrition? I've learned all these things in the decades that I've been trying to figure out my body and food. What's actually true? How does my body actually work? So those things in tandem together, I would say that first step of if you have any of those people in your life, starting there, and then they can help you reach out and find a dietitian or find a therapist. If you have a therapist, maybe have we talked about food before? If we have a doctor, can we tell them we might be struggling with this? And do you have any therapists or a dietitian who specializes in that you might recommend? You can also go to a website like Health Profs and kind of filter by your area and say dietitian. You could say dietitian Missouri, St. Louis, and then the specialty of eating disorders. And you come up with a list of people who fit that criteria for you.
Mhm. Great.
Then from a tangible place, obviously, often we need professional help, but I'm biased. I always say, if we can, the hardest thing to do, but stop restricting, trying to eat throughout the day. So if I find myself struggling and feeling like I ate too much and then thinking I need to skip my next 2 meals, is saying, okay, no, can I, the next day we start over, start by eating breakfast, a few hours later, eat a snack or lunch. I mean, it sounds very basic, but I think reminding yourself that even if you feel like you quote messed up, that it's important for your body to keep eating. Physically, we still deserve to keep eating. It's important for our survival. And also it actually will, ironically, help prevent the cycle.
Yes, yes, absolutely. Um, yeah, yeah. And I think that that is so helpful to kind of just have those tips, but then also know which professionals to look for. And I'm glad that you brought up like specifically using health profs and search engines and to find people who have that experience
Yeah.
because not every doctor or therapist or dietitian does have, not everyone has that experience with eating disorders. And even binge eating disorder, even though as common as it is, like you mentioned, not everybody has that expertise. So you definitely ideally can find somebody that has that area of focus.
Yeah, I think that's really important. Just as if someone was looking for a dietitian who specialized in diabetes, I would say, yes, I'm a dietitian, but probably not the best for you. I'm not up on the best ways to treat that and get the most success for that. So I think making sure eating disorders are complicated. And so definitely knowing that you deserve someone who understands what we're dealing with and has a plan to get you where we want to go.
Yeah, yeah. And I think that that's been so rewarding. What we've kind of been doing is networking with other health professionals in Missouri and kind of learning each other's area of expertise so we can build that network. So even if what you're looking for is not what we have to offer, we can refer you to those people. So that's part of our goal with this virtual health summit is that you can hear from the different health experts in their areas of expertise.
Yeah, absolutely.
Um, yeah, and thank you so much. This was wonderful. I'm sure that somebody listening, they are going to want to learn more about you and your services. So, how would those people find you?
Yes. Yes, I would love for anybody to reach out if you're interested. You can go to my website. It's www.restorednutrition.com. It's spelled a little funny. It's like restored with an RD and not like I was trying to be clever, but it's not helpful for like people, but it's too late. The ship has sailed. So we can put that in the description so you know how to find it. Or you can email me. My email is Emily Wendt RD for registered dietitian at gmail.com. Head to my website, there's a contact form, or sent me an email, and I would love to kind of get in touch and hear how I could help.
Okay, perfect. Well, thank you so much for spending this time and sharing your expertise. Are there any last minute comments that you have or anything else you'd like to share?
I don't think so. I mean, I'm thankful for the opportunity. I hope that this was helpful for someone. If nothing else, helped reduce a little bit of shame that this is something that lots of people struggle with. And if you are ready to kind of take a step, I would love to help.
Perfect. Well, thanks again, and I look forward to collaborating more in the future.
Of course. Thanks for having me.